What I find with the injectables is that people are losing fat and muscle. They're more getting hyped up into, I lost 2 pounds in a week. And they're not actually realizing that if a pound of that is muscle, you are going in the wrong direction. It's really, really important for people not to get caught up in how fast is the weight coming off, but am I losing only fat and not muscle?
She blinded me with science. She blinded me
GLP-1 has become one of the most talked about topics in health right now, but most people don't actually understand what it is. You've probably heard of the drugs, you've seen it in headlines, maybe you've even considered them yourself, or maybe you've taken it. But here's the part that often gets missed. GLP-1 isn't something foreign to your body. It's something your body already produces. So the real question isn't what is GLP-1, it's how is your body using it and what happens when we start to interfere with that system. So today on What the Health is Happening with Dr. V, we're breaking this down clearly. No hype, no fear, just biology. And we're going to talk about what GLP-1 actually does, the difference between supporting your body's natural production versus introducing it externally, and where things like natural compounds like Calocurb fit into this conversation. So if you felt overwhelmed or unsure about what's real versus what's trending, this episode is for you. So I'm super excited to dive into this with you, Dr. V. I know this is a hot topic that you're excited about as well. Are you excited for this episode?
Everybody asked me about GLP-1s. Everybody.
Everybody. I'm sure. I mean, even if you don't want to hear about it, you hear about it.
Right.
It's everywhere. Ozempic, Mounjaro, Wegovy, semaglutide. There's like so many different versions of it. And I know a little bit about it from hosting shows and from, just existing and hearing and seeing them everywhere. So I don't know anything about Calocurb though. So I'm really excited to learn about that. And I also didn't know that GLP is produced in your body. So you're gonna inform me of all these things today and all of the listeners as well. So let's start with the basics. So like I said, most people have heard of GLP-1. It's thrown around all over, right? But they don't actually know what those letters stand for. So can you break down what GLP-1 really is and why this hormone actually really, really matters?
GLP stands for glucagon-like peptide. That's what the G and the L and the P stand for. And it's made in your body, primarily in your small intestines, your large intestines. It's also made in your pancreas and a little bit in your brainstem. Your body normally makes this glucagon-like peptide, right? What you find is some people have more of it and some people have less of it. Those that have less of it have more of a problem with gaining weight, diabetes, type 2, etc. And if you have more of it, you may find it easier to maintain a weight. Those people that like, I'm still the same size I was in high school.
Right.
They may have more GLP-1s.
Mm-hmm. Exactly, which I'm sure most people would prefer. Most people don't have a lot of that. So no, it's super interesting because I hear about GLP-1s all the time like everyone else, but I actually had no idea it was something that we're naturally producing. And a lot of listeners assume GLP-1 is a drug, but you've explained and said it's actually something we already make. So can you explain the difference between endogenous and exogenous GLP-1 and why the distinction matters so much?
Exogenous is something that you're actually giving your body from the outside. A common example would be you have diabetes and you give yourself insulin because your body's not producing enough insulin. So that's exogenous, right? Endogenous means you take something that makes your body produce more insulin in the example that I gave for diabetes, right? Some people take certain diabetic medications that is not insulin, but it's pills, and it makes their pancreas produce more endogenously. Similarly, with GLP-1s, you can get GLP-1s exogenously, and those are the ones that you normally see the commercials for, which is, the injectables. Sometimes they're in a pill format, and that's giving your body from the outside GLP-1s, which is very different from making your body actually produce its own GLP-1s, which is what certain supplements do, like Calocurb.
Okay, that's so interesting. And what does GLP-1 actually do in the body when it's released? Can you kind of walk us through the chain reaction from eating a meal to feeling full?
When you actually eat a meal, your body actually releases the GLP-1 in your body. And, depending upon how much you have of it, what GLP-1 normally does is it makes sure it slows the emptying of your stomach. It signals to your brain that you're actually like full. It increases the release of insulin and decreases the release of glucagon. So your body actually has better control of your blood sugars. And it just kind of overall um, kind of makes you feel full, and also improves the metabolism of what you're eating, your meal, right? You're less likely to get those really, really high blood sugar spikes. Sometimes you eat, and then after you eat, you want to go to sleep. That's because you had a really high blood sugar spike, and then it goes down and you get tired. So that all of that is kind of evened out. Now, some people are also saying that what they do is they have a lot of talk in their mind about, what am I going to have for dinner? What am I going to eat? Cravings. Some people are also seeing that it's kind of making a difference with that as well.
And that's what is referred to as food noise. Is that right?
Yes, that's what people refer to as food noise. Right, right.
Yeah, I'm telling you, we hear about it all the time now. So
Yeah.
it's something that, helps.
Who knew we had all this food noise going on? I mean, I knew I did, but I assumed I was the only one.
Right. Exactly. You realize you're not so much different from everyone else, right?
Right.
And I
Exactly.
think, and there's so many injectables, so many GLP-1 injectables, medications dominating headlines. I mean, you hear about it even in Hollywood all the time, Ozempic, and for example, but Ozempic, Wegovy, Zepbound, Mounjaro, there's so many, but now compounded versions from telehealth companies also. So what concerns are you seeing as an ER physician?
One is that a lot of these medications, particularly the injectables, they can be really strong, right? People can get a lot of nausea or vomiting, reflux, particularly as they go up in the dosage. Right. And a lot of times people are starting at a lower dose. You start at a lower dose and then sort of ramp your way up on these injectables. And then people start to get some side effects. Do you know what I mean? As far as nausea and vomiting, some people get diarrhea. Some people feel a little bloated. It's kind of different for different people, right? And it's also different based upon the medications, right? When you talk about Mounjaro versus Zepbound and Wegovy and Ozempic, it's all about, are you already a type 2 diabetic or not, right? And are we looking at treating type 2 diabetes and also weight loss, or is this a problem of only weight loss? So normally what happens is your physician will actually check your hemoglobin A1C, check a couple of other tests to kind of see where you are in that. Well, that's the one good thing that's come out of this, is people are getting their hemoglobin A1Cs checked.
That is true, because I believe even for the telehealth doctor visits with the compounded things, you still have to go and get your blood work done. So
Yes.
that is a good point.
Yes, and that is a good thing. Now, compounding medications, I don't think people really understand what a compounded medication is. When you get a prescription that is a pharmaceutical company, that's, Wegovy, Zepbound, Ozempic, that's made in a manufacturing plant with really, really high quality standards, right? Where they have to test and make sure everything comes out the same. Compounding is where the local pharmacist puts it together. Right. That's where we're seeing that there are some problems, because different people may have different formulas. There are, some people are saying, I got a bad batch this time, I got a good batch last time. And I think that's where the FDA is kind of looking at coming in and actually possibly eliminating compounded medications, because the quality control is not as good.
That is so interesting because I never really thought about what that meant, like compound pharmacy, but I have heard people that I know that have taken compound medicines, like I think it was like
Yes.
semaglutide and things like that, say that, oh, this time I felt this way, and this week I felt this way, and last week I lost, 5 pounds, and this week I didn't lose anything. And I just thought it was different factors, which I'm sure could play a part, but that's so interesting that it could be a bad batch or a different batch or a different formula. So
Yeah.
interesting. It also sounds a little scary, the inconsistency with it. Like, not.
Yeah, I mean, so the compounding pharmacies really kind of came in vogue when people were using hormone patches to treat menopause. Right. And so, and those are patches that are on your skin. And I think, that's a little bit different than when you start injecting something and it's compounded, or ingesting something and it's compounded. So, I would not be surprised if we don't see the compounded medications taken off the market, because there was a recent article in the Washington Post of someone that actually had a liver transplant, had liver failure and had to have a liver transplant as a result of a compounded medication.
No, wow, that's so interesting. And yeah, that just made me think of something. A friend of mine, I don't know, about a year ago. So it was like also when it was becoming a little bit more mainstream, took some injectable from a compounded pharmacy, and she ended up in the emergency room, actually. Not funny,
Yeah.
but ironically so, because she just felt so dizzy, and she felt like she was going to pass out, and got super, super sick from it. And it had to be that. It was the only thing that was different in what she was taking.
Right. Right.
So yeah, it could be scary for sure. And I think also another thing with the injectables, so many people lose weight on them, but they gain it back the moment they stop, or if not shortly after.
Yeah.
Or in certain cases where insurance plays a part, the insurance drops the coverage and then they gain the weight back. But why does that rebound happen? And what should people be thinking about in the long term with these injectables?
There's a couple of reasons why this happens. And so number one is, I think when people are losing weight, they need to make sure to get a scale and they need to measure their muscle mass, because you want to lose weight and lose fat. You don't want to lose weight and lose muscle. And muscle is what you actually need for your metabolism. So if you lose weight and you lose muscle, then it is going to be easier for you to gain the weight back, right? The other thing is that you're injecting exogenously this GLP-1, and then you're taking it away. We're seeing a lot of rebound. And a lot of times I believe that people do need to kind of move over to a pill that actually will, like Calocurb, that will get their body to actually begin to actually make more GLP-1 on its own. Right. They have to transition, because if you go just from having the injectables to now I don't have the injectables, you're going to gain all the weight back. And people you can't stay on the injectable all your life. It's very, very hard. And they're extremely expensive.
Yeah, absolutely. No, they definitely are expensive. And it's one of those things where I've heard you kind of you can wean yourself off it, or you can take it almost forever, but they have to be cold. Who wants to inject themselves forever for something? It seems
It's
really
a lot. It's a lot.
Yeah. And I'm not a fan of needles, so
Yeah.
I wouldn't want to do that forever. But let's talk a little bit more about Calocurb. So what is it exactly, and where does it come from? And also, how did you even first come across it? Because with all this talk about injectables, no one's talking about Calocurb, really.
Yes, I actually first came across Calocurb at a wellness conference in Florida, and it is basically the most bitter plant in the world, and they make it into a gel cap. It's a hop or a flower, and basically bitterness actually makes your body produce GLP-1s. So I don't know if you remember, but they used to have where they'd say, if you're dieting, have lemon and water, right? It's because that's a bitterness. That's a bitter taste. Calocurb is basically take the lemon and water and multiply it times 100 times, right? So that you've got the most bitter plant in the world. And then they made it into a gel cap so that you can actually take it, because normally you wouldn't be able to eat anything that's that bitter. So that basically makes your body actually begin to actually produce its own GLP-1. And I don't see people have as many side effects as far as the nausea and the vomiting and the diarrhea. It's a little bit more gentle.
And I was going to ask how Calocurb actually works within the body and how it's, I guess, fundamentally different than an injection, but you did just touch on that. But is there anything beyond that that you didn't mention? I know, understand it's more gentle.
Yeah.
But
No, the main thing is that Calocurb is actually increasing your body's own ability to produce GLP-1s. There's no GLP-1 in the Calocurb pill. The pill is actually making your body produce its own GLP-1.
Yeah, that's so interesting. And I'm wondering why it's not, I guess, more mainstream, but I guess in terms of, not maybe the best for health related things, but you would think that a pill and something natural would be talked about more.
Absolutely. And here's the thing that I found to be really interesting when I met the people from New Zealand is that it was studied before Mounjaro. It has more research on it than Mounjaro, Ozempic, Zepbound. It's actually has a lot of literature on it. And so, I think that, I think a lot of times, the pharmaceutical companies come in, they've got all the marketing dollars, you know what I mean? And they're able to sort of dominate. And sometimes, it takes a little searching to sort of find something that might be a little bit more natural or a little bit more gentle and kind of work a little bit better for people.
So I know you interviewed your patient on the previous show and she had lost over 8 pounds in 7 weeks or something like that without exercise and without the nausea or vomiting that people really tend to report frequently with the injectable. So what were the most striking parts of her experience, do you think, for you as a physician?
Well, I think the most striking part for her was that she's never in her life lost weight without exercising. And she was dealing with surgery on her foot. So she actually couldn't walk, right? And she was actually less active than she normally is. So I think that what was actually really surprising for her was that it really worked during a time period when she was less active. She was very concerned about being less active as a result of this surgery and gaining weight during that time period.
Of course. Yeah, no, that makes a ton of sense. And I guess I'm curious, does Calocurb, being that it helps you produce something that's already naturally within your body, do you think that people lose the same amount of weight that people lose with injectables, or do you think weight loss is more significant with injectables?
So I think with injectables, people are losing a lot of muscle. So what's happening is, what I find with the injectables is that people are losing fat and muscle, and they're more getting hyped up into, I lost 2 pounds in a week. I lost 2.5 pounds in a week. And they're not actually realizing that, if a pound of that is muscle, you are going in the wrong direction. And so that's why I go back to the fact that the scale is really important. We've got scales now that'll measure your visceral fat, your muscle, your subcutaneous fat, your bones. It'll give you everything. So I think it's really, really important for people not to get caught up in how fast is the weight coming off, but am I losing only fat and not muscle? One of the things that she noticed from her scale was that her muscle mass didn't change at all.
Oh, wow.
So she did not lose a single pound of muscle.
Oh, that's super interesting. Yeah. And even, talking about this too, I'm curious because it sounds like this might not happen with Calocurb, but with the injectables, people talk about, Ozempic face, or, they're losing the fat and the weight, but they're losing the muscle, they're losing the collagen, they're losing all these other things that go along with it. So I wonder how that differs too with Calocurb. I'm curious because if they're
the Ozempic face is when you lose muscle in your face,
muscle and the collagen, yeah,
right. And so, as you can imagine, right, like if I decide I want to go to the gym and work out my arms and rebuild the muscles in my arms, I can rebuild the muscles in my arms. What are you doing to rebuild the muscles in your face?
Yeah.
Right? People are not exercising their face and rebuilding those muscles, right? So they wind up with that Ozempic face, for the rest of their lives, right? And so it's really, really important. It is really, really important that people actually get a scale and they measure and make sure that they're actually keeping muscle and
Absolutely.
losing fat.
Absolutely. And I think it's, especially with like med spas, I almost did a GLP-1 through a med spa when I was in Florida a while ago, and they did have the scale and they did track all of the muscle and things like that. So I think it's also just important to talk about that. Some people do it the right way, and then I know there's some places that don't, that you could just sign up and get, sent this, and then that's probably when people are losing all their muscle from their face, body, and all kinds of things. But for someone listening who's currently on an injectable but wants to either come off or wean off, or for someone who's on the fence about even starting one, how would you advise them to think about Calocurb as part of their plan?
Well, I would say, first of all, uh, I think we're going to put the QR code in here, right? I would say the first thing would be go to the QR code and go check out the website so that way you can really understand how it works, right? They really go over on that website how to use it, how to order it, and everything that you need to do. So I would tell people, go to the QR code. It's got all the information. It's got all the research there. That's what I did when I first found out about it. And that's where I downloaded all the information, read all the research, really kind of figured out everything about it. And so that's what I would recommend people do. Go to the QR code, and then you can actually, you can see it for yourself.
Amazing. And so I know the cost is a huge barrier for so many people, especially some of our listeners and anyone who really wants to start their journey with whether it's an injectable or Calocurb. But can you compare what people are realistically paying out of pocket for the prescription and the compounded options versus Calocurb, and how can listeners try it?
So the prescriptions, the injectables, without insurance are usually around $1,000 to $1,200 a month, right? And so with insurance, people, depending upon what their insurance, they could be paying half, they could be paying 20%. It really kind of depends upon what their insurance is. The compounded medications, usually the injectables are still a couple $100 a month. And I find that in general, the pills don't really work as well. Calocurb is $90 for about a 25-day supply. So that kind of gives you some idea of, the cost effectiveness of it.
And it's something you take every day? It's like a daily pill?
Yes, it's a daily. You actually take it. You ramp up and you take it twice a day when you get up to the full dose.
Okay. Oh, so it's similar in terms of ramping up the dose.
Ramping up, yeah. You ramp up over a week rather than like over like a month, and you ramp up over like a week, and then the full dose is 2 tablets twice a day. There are two different milligrams of it, but the one that everyone starts with is 125 milligrams. So the higher milligram dosage you can only get through a physician.
Okay. Good.
Yeah. Or through a medical, I should say through a medical facility. Right. So the one that people can actually get through the QR code is the 125 milligram.
Okay, yeah, no, that's great. That's great to know. And I do know, even with it sounds so much simpler and easier and more gentle on your body completely. Because I know
Yeah.
the
Yes.
injectable it can be aggressive, and you have to build up a tolerance over time. And each week it's like starting over in a way, because it can be hard on your body. And GLP is a powerful tool, but like anything else in health, context matters. And what this really comes down to is understanding your own biology, your goals, and the trade-offs you're willing to make, because this isn't just about weight. It's about how your body regulates hunger, metabolism, and energy over time. And if this episode helped you think about GLP-1 in a more grounded, informed way, make sure you share it with someone who's trying to make sense of all this noise right now and who may want to start their journey as well. And if you want more conversations like this, where we focus on clarity over hype, make sure you're following the show, What the Health is Happening with Dr. V. Make sure you share this episode, send it to someone who can use it. Well, make sure the QR code for Calocurb is also linked below. And this was a great conversation. I know I'm definitely going to check it out. And thank you so much, Dr. V. And we will definitely see you in the next episode. And I can't wait to continue our conversations.
All right. Thank you.